So, tonight we're going to talk about cancer treatments and some of the things that we can do to help to manage this condition. So, one of the first options, we talked about in another PowerPoint. Real quick before I get too deep into this is a PowerPoint for complex last semester students for cancer. You do not need to know about cancer treatments in this in depth if you are in the adult course. So, please stop this video right now if you're watching it and you are in the adult course. All right, disclaimer over. Let's talk first about surgical options. In another PowerPoint, we discuss the kind of the general goals that we want to have. Of course, first and foremost, we'd love to prevent cancer, before it even happens. But our big goals are either to cure, to control, or for supportive or palliative care. And those are going to be our same goals as we're looking at these options as well. So surgery, we can actually use surgery to prevent cancer. So in other words, patients that are really high risk, so people that have the BRCA gene, we could sometimes we'll have like a prophylactic mastectomy or hysterectomy or oophorectomy to prevent their risk of cancer if they're really high risk. And that's a choice, of course, that each patient can make. And a lot of insurances actually cover it now because the cost of that surgery is a lot less than it will be to have to treat cancer. A lot of people are kind of going that route, getting genetic testing, and then if they're at risk, having the organs and things that are not essential organs to what do you call it, prevent their risk of having to have cancer in those areas. Also, you can do surgery for cure, so cut to remove the cancer, take all the cancer out to hopefully get into remission. Sometimes we cut or surgically remove cancer for control. So maybe we can't take all the tumor out, but maybe we can make it smaller. So I'll be in a lot of these videos talking about people I know that have cancer or have had cancer. And so my mother-in-law, she has lung cancer, and she what do you call it? It's actually wrapped around her mediastinum and around some of her heart vessels. And so when they went in, they were able to remove a lot of the tumor from her lung, but obviously the ones that are the part of the cancer that was wrapped around her heart vessels, it's not safe to remove because it's too close to an area that could lead to a lot of damage. So sometimes we're just trying to make it smaller to try to prevent that effect that it's having in that area. Sometimes we can also do it for supportive or palliative care. So we're trying to cut to minimize symptoms and maximize quality of life or functioning. So in other words, maybe someone has cancer and it's unable to, or we're not able to completely like remove it, or we know that this patient is not going to have a good prognosis. But sometimes we can go in and make it smaller. Sometimes we can also do other surgeries that are going to support a patient. So, like for example, a patient that maybe has liver cancer, maybe giving them, if they're having really bad ascites, pleural effusion, or things like that as a side effect of their cancer, going in and treating those problems, doing a paracentesis, things like that, to try to minimize their symptoms, improve their quality of life, or doing other procedures just to kind of help support, the discomfort that comes when their organs aren't functioning the way that they normally would be if they didn't have the cancer. There's also chemotherapy. And so chemotherapy, it's going to help to get rid of and reduce the number of, it can do either or. It can either help to reduce or it can help to get rid of cancer cells at the tumor sites. And again, we kind of look at it that cure, control, or palliative. So I can use chemotherapy to cure or completely get rid of cancer. I can use it to control or reduce or minimize the cancer's presence, or I can use it as palliative to reduce or minimize pain symptoms. So, sometimes the chemotherapies, just depending on how severe it is, sometimes it's going to be, able to completely help that patient get rid of their cancer, but other times it's going to be more just a little, let's try to just make it better in this moment. It's something to keep in mind. There are a lot of potential side effects and complications, which is why I have a whole other PowerPoint about side effects of these medications, because there's so many ways head to toe that these medications can affect. Because while chemotherapy kills cancer cells, it also destroys good cells as well, and so there can be a lot of side effects of that. So chemotherapy can be given oral, IM, sub-Q, topical, and there's a ton of more ways it talks about in your book. Chemotherapy should be given by a certified chemotherapy nurse, especially if we're talking about intravenous, chemotherapy. If you're a nurse on the floor and you are able to give these meds like pills and things like that, keep in mind you should double glove and make sure that you are really protecting yourself and that other patient and any of their family members. And so, like most of the time with these patients, we try not to actually touch the pill itself. Like we open into the pill container, try to hand that pill container straight to the patient and have them drop it in their mouth and not even touch it with their hands, because it definitely can cause side effects to their skin. If it's given IV, a central line is preferred because it is a extreme vesicant, and if it does infiltrate, it could cause serious damage, and the patient could have loss of limb from that tissue damage. There's also radiation, and radiation, they kind of use radiation beams, and it helps again to cure, to completely get rid of, to control, to make it smaller, or to provide palliative care to improve symptoms. And it also can be external, internal. So, in other words, a patient can go in and get beams of radiation, from like a machine externally, or they can actually get we call radioactive beads and things like that inserted inside of them that are going to over time or long term, it's what's known as brachytherapy, release the radiation. So keep in mind there's patients that officially, like, because of the radiation beads and stuff they have in them, they are radioactive, so they're like emitting this radiation. So a lot of nurses that work on these floors, they literally wear a like a badge that like measures how much radiation they're being exposed to over time, to kind of keep an eye on that, because it is a high risk for side effects themselves, because radiation is a risk factor for cancer itself. There's also what's known as immuno or targeted therapy. And when you're looking at immunotherapy, think of it as a medication that helps to create an environment that makes it hard for cancer to grow. It also can directly attack cancer itself as well. For targeted therapies, they interfere with cancer cell growth at specific cell receptors. So when you think targeted, it's very specific, but it does this without hurting the healthy cells as much as chemotherapy does. So definitely, a lot of research is being put into more of these targeted therapies because they have some of those less caustic effects. Common side effects for a lot of these are going to be, especially the targeted therapies, it's going to be flu-like symptoms. So we want to encourage oral intake, and a lot of times they can take acetaminophen to prevent them from having that. And that's for the targeted therapies, especially. So other treatments that patients can have, they can have hormone therapy, they can have stem cell transplant or gene therapy, just depending on the type of cancer. Like some of the female and male cancers, hormone therapy is used. Stem cell transplant is something kind of new and in the works, but it's used in a variety of cancers. And gene therapy is becoming more popular, with different types of cancer as well. So, what's my role as the nurse in these cancer treatments? Majority of these medications, at some level, some more than others, chemotherapy is going to be the most intense, and then those others that I listed are not going to be as bad, but definitely can cause bone marrow suppression. So, I need to monitor the patient's CBC, especially looking for anemia, thrombocytopenia, and neutropenia. And these are three really common complications, and I'll talk about them in my complications PowerPoint. I also want to, in general, just monitor for infection. So, even though the patient is at risk for neutropenia, I want to be monitoring their temperature closely and looking for any signs of infection because they're going to be very high risk. Manage symptoms, head to toe problems. That's why I have an entire PowerPoint over all the head to toe problems. And then encouraging hydration and nutrition. And I'm going to talk more about how, like, your role, because your role as a nurse is much deeper than this. There's a lot of symptoms and things you want to look at, but check out that other PowerPoint to learn more about that. So yeah, so that's just some basics on cancer treatment. I hope this helped to simplify it a little bit. I'll see you for the next one.